Well, greetings. Welcome to another edition of Calf Chat. My name is Dr. Noah Litherland, visiting with you live from Madison, Wisconsin. Looking forward to talking with you today about the Veterinary Feed Directive, the VFD, something you've probably heard a little bit about before. That's starting next January 1st. It'll be an exciting day in a lot of ways, but a whole lot probably won't really change for a lot of our producers. Definitely one of the things we're advocating is for producers to really have a good heart-to-heart conversation with their veterinarian before that time and really determine what are the veterinary and medical needs of their farms in terms of feed antibiotics that they're going to need to have in place. So if they have a prescription, they can get those feed additives and use those in ways prescribed normally in an uninterrupted fashion. Let's talk about some strategies to move calves through even with our VFD in place. The first thing is, of course, as always, working with our dry cows from a vaccination standpoint. Getting vaccinations that are appropriate into the cows, whether they're before breeding for heifers or boostering if we're talking about cows, so that those cows can transfer that immunity and protection into the colostrum so that when the calf consumes that, they're getting that natural immunity. Always focusing on colostrum quality. The cleaner and better quality colostrum we can produce, the better quality calves we're going to have, and the reduced need for some of the antibiotics that we really have used in the past. Really looking for reducing exposure as well. Having a very, very clean maternity pen, so when that calf first comes into this world, they come into a clean area. Oftentimes we really advocate for individual calving pens versus group calving pens. Certainly both can work, but we can keep those individual pens a little bit cleaner and really minimize the number of disease pathogens that calf may be potentially exposed to. As always, that first 24 hours is amazingly critical, right? Not only from a colostrum standpoint, but also getting the calf vaccinations on board and making sure we really do a great job of dipping that navel. That navel can be a highway for a lot of the pathogens that may cause systemic infections in the calf, and by dipping that navel with 7% tincture of iodine, we can really do a good job of preventing some of those infections from occurring. Sanitation is the other thing we often talk about. Cryptosporidium and Clostridium are two of the primary pathogens that we see in baby calves. Often Salmonella and E. coli, rotavirus, coronavirus get a lot of press, and rightfully so, but from a commonality standpoint, Crypto and Clostridium are probably the two pathogens that cause the majority of calf scours. And we really need to focus on proper sanitation of cleaning of milk feeding equipment and the housing for calves as far as that goes. When we do have calves that are sick, certainly antibiotics from a veterinary standpoint are often warranted, depending upon their point of view. If we're not going to use antibiotics, then certainly the calves can benefit hugely from fluid therapy. When I say fluid therapy, we're talking about, of course, electrolytes, making sure that we're adding electrolytes to water and adding that as a third or a fourth meal for the calves. Maybe correcting the metabolic acidosis through the use of lactated ringers. Some of the feed additives, as we look into the future, that really we think are going to be applicable in terms of getting a little better calf health without antibiotic use, would certainly be animal plasma. Plasma harvested from animals has a tremendous number of growth factors and immune components that really can help calves from an immune function standpoint. Some direct-fed microbials are going to probably be very, very useful. There are some direct-fed microbials out there, bacteria, that actually eat Clostridium. So one of those pathogens we talked about earlier that cause problems, some direct-fed microbials can really combat against those guys. Certainly yeast cell wall products like moss can definitely help bind some of the pathogens, prevent them from attaching to the small intestine. Certainly organic trace minerals, those minerals that are bound to amino acids or chelated to amino acids, certainly can improve immune function and overall gut integrity. And finally, making sure we have appropriate vitamin intake as well. Vitamins A, D, and E, and certainly the B vitamins, all important to immune function and normal energy metabolism. So kind of in summary, we're really looking to develop a good, strong relationship with veterinarians early on in the process. We've got at least 8 months or so here before the Veterinary Feed Directive takes place, and so let's make sure we take that time, use it wisely, and develop a relationship with their veterinarians so that they know what types of challenges the farm is used to experiencing. If we can't fix all those challenges, let's make sure we have a plan in place from a drug standpoint to be able to treat those calves if they do get sick. With that, I'm Noah Litherland, and I hope you have a great day. Thanks for joining us for another edition of Calf Chat.